name is Jason Petik, and I'm the CEO at Sydney Regional Medical Center. And I've been asked to talk a little bit about the year 2020. The year 2020 is something that a lot of people don't want to remember, but I think we have learned a lot from 2020. We learned how resilient our staff was. We've learned how resilient our patients are and our patients' families are. And I think one of the things that we have learned and we've had to kind of focus back on, and that's basic healthcare, neighbors taking care of neighbors, looking back at what we really need to do for our community and what we need to be there for our community in these times. It's very easy to get caught up in day-to-day boring medical care, if you will, for the last 5 years, and also the pandemic shows up and you really find out what your organization is made of and what your people are made of and how wonderful they are. And I think that was one of the things that I learned. 2020 was also very interesting because at the same time when we started dealing with the pandemic, we were also going through electronic medical record conversion, which is probably one of the most challenging things an organization will ever do by itself, let alone put on top of it a pandemic. And both of them had administration had to have several different approaches on leadership. We had to have a leadership style with the pandemic that was very open and was very open to everybody to make decisions and to move forward, because people had to make those right decisions where they were at, when they were doing those things. Whereas the Epic implementation, everybody was very controlling almost, and very ownership driven, where everybody had tie-in to make that project work. So it was very dynamic to have almost two opposite styles of management working at the same time, but getting everything done at the same time. So that was also I was very proud of that, to see the organization be able to pull that off. Another thing with leadership in the last year, 2020, for myself personally, was not to be able to walk around and see people and talk to patients, talk to family members, see how this has been affecting them, because not only were our workers quarantined, but we were quarantined from administration's perspective. So we were kind of not able to be into those patient care areas to see our coworkers doing the wonderful things that they were doing, only hearing the stories and only being able to reach out to them via phone and try to comfort them in some ways, having them have to fight through the mask issue and all the personal protective equipment that they had to wear, and still try to provide that loving touch to people. It's very difficult not to be able to go up to someone and shake their hand, pat them on the back, tell them thank you for everything that they're doing, reaching out to the families to ask what they need. So again, time and commitment, and being able to recognize those things that sometimes get taken for granted, that you want to make sure that you reinstill in the way you do things on a day-to-day basis.